So psychiatry, we told, it is a medical specialty, and psychology is the discipline that studies normal and abnormal behavior, and that counseling is mainly adopted in psychology. Then this mental illness may be due to the difference in size of the brain, or maybe difference in the there is an alteration, or if there is an imbalance in the secretion of this neurotransmitters, also will result in mental illness. Neurotransmitters are those substances, the dopamine, then acetylcholine, are some of the neurotransmitters with the help of which the impulses are being transmitted through the nerves. Communication, neurotransmitters are those substances which helps in the your psychomotor activities and all. So if there is an inadequate regulation, the release and synthesis inadequate, that will also cause this mental illness. Mental illness, brain in the size difference neurotransmitters in the release in the production regulation proper that will result in this. There is mental illness. The age and gender are also determine this mental illness, and mood disorders such as depression, anxiety. Once in a while, all people might have gone through some of the mental illness. ഒരു വിഷമോ ദുഃഖമോ ഒക്കെ കുറച്ച് ദിവസമൊക്കെ ഒരു ദിവസം ഡിപ്രസ്ഡ് ആയിട്ടിരിക്കും, ഇപ്പൊ എന്തെങ്കിലും ഒരു കാര്യം വരുമ്പോൾ അത് കഴിയുമ്പോഴേക്കും വിൽ ബി കമ്മിങ് ഔട്ട്. So all people, as we say, might have been gone through one of in one day or half a day through some of this thing. That is, mood disorders such as depression, anxiety disorders, അത് prolong ചെയ്യുമ്പോഴാണ് it will lead to this condition. And it is actually genetics. Mental illness to some extent genetics have a involved. അതായത് നമ്മുടെ ജീൻസ് റെഗുലേറ്റ് ചെയ്യുന്നു. ജീൻസ് റെഗുലേറ്റ് ദി മെന്റൽ ഇൽനെസ്. അപ്പോൾ ഒരു അബ്നോർമൽ ബിഹേവിയർ അല്ലെങ്കിൽ നമ്മുടെ ബ്രെയിനിന്റെ സൈസ്, ഞാൻ പറഞ്ഞു ബ്രെയിനിന്റെ സൈസ് നോർമൽ അല്ല എങ്കിൽ ഇറ്റ് വിൽ എഫക്ട് the neural transmission or the coordination of the signals between the neurons. Here you can see the neurotransmitters and the neurons communicate in it is with the help of this neurotransmitters. So the mental illness the genetics or inheritance pattern is one reason. Environment, of course, if a person is subjected to a very tragic environmental condition, that may also will lead to brain disorder. So hereditary as well as the environmental factors will lead to the brain disorder or mental illness. Then mental illness may begin at the childhood. Kunyile develop maybe due to some problematic situation with that child faced at school, and they may persist to adolescence. School എന്തെങ്കിലും ഒരു വിഷമം ഫേസ് ചെയ്ത് കഴിഞ്ഞാൽ that may have been continuing towards the adulthood, and after that it will also adolescence ന് ശേഷം adulthood എത്തുമ്പോഴേക്കും it will persist. Then some of these disorders, some of the common disorders which are found are attention deficit hyperactivity disorder. Some of the children at school, mainly the boys who are less than 7 years old, boys who are less than 7 years old will be hyperactive. Hyperactive means അവരെ എല്ലാവരും ശ്രദ്ധിക്കാൻ വേണ്ടിയിട്ട് they may do some things. ഇല്ലേ, ചില കുട്ടികൾ എപ്പോഴും അവരെ ശ്രദ്ധിക്കാൻ വേണ്ടിയിട്ട് ഓരോ കാര്യങ്ങൾ, ഇപ്പം എപ്പോഴും കല്ലെടുത്ത് വേറൊരാളെ അറിയുക, അല്ലെങ്കിൽ എപ്പോഴും അവരെ എല്ലാവരും ശ്രദ്ധിക്കാൻ വേണ്ടിയിട്ട് they may do something. That is known as attention deficit hyperactivity disorder or ADHD. Attention deficit. അവർക്ക് പ്രോപ്പർ ആയിട്ടുള്ള അറ്റൻഷൻ കിട്ടുന്നില്ല എന്ന ഒരു ഫീലിംഗ് മനസ്സിലുള്ളത് കൊണ്ട് they will do certain things to attract people towards them. അവർക്ക് ഇമ്പോർട്ടൻസ് കിട്ടുന്നില്ല എന്നൊരു ഫീൽ ഉള്ളിലുള്ള കുട്ടികൾ എന്തെങ്കിലും ഹൈപ്പർ ആക്റ്റീവ് ആയിട്ട് എന്തെങ്കിലും കാര്യങ്ങളൊക്കെ അങ്ങ് ചെയ്തിട്ടിരിക്കും to make other people look at them. That is known as attention deficit disorder. Then other disorders associated with this are autism spectrum disease and general anxiety disorder or GAD. And mental illness affects all cultures. Mental illness in a group or in a community അല്ലെങ്കിൽ in a creed, in a locality ഉള്ള ആൾക്കാർക്ക് വരുള്ളൂ എന്നൊന്നുമില്ല. It affects all culture, it affects all races, it affects all sex. The male and female both are can have mental illness. And socio-economic class, പാവപ്പെട്ടവർക്ക് വരണമെന്നോ പൈസ ഉള്ളവർക്ക് വരണമെന്നോ ആവറേജുകാർക്ക് വരണമെന്നൊന്നുമില്ല. ഏതൊരു കാറ്റഗറിയിലെ ഒരാളിനെയും എഫക്റ്റ് ചെയ്യാം this mental illness based on his genetic pattern and the environment in which he lives and the daily life pattern which he follows. ഈ മൂന്ന് കാര്യങ്ങൾ വരുമ്പോഴാണ് mental stability പ്രോപ്പർ ആയിട്ട് കൊണ്ടുപോകാൻ പറ്റുള്ളൂ. Now these are some of the depression. ഇല്ലേ, പെട്ടെന്ന് കുഞ്ഞുങ്ങളിൽ കണ്ടുപിടിക്കാൻ പറ്റുന്ന ഒരു കാര്യമാണ്. സ്കൂളിൽ പോകാൻ വലിയ താല്പര്യമൊന്നും കാണൂല. You can see here most of the children may be dragged to school by their parents or they may be compelled to go to school. They will be under the stress of this parents dragging them to school, pulling them and pushing them inside the bus and all. And this is due to sadness, വിഷമം കൊണ്ടാകാം, irritability. They may be having some problem at the school but they don't want to share with the parents. Then clinginess. They will be clinging to something. Then refusing to go to school. പിന്നെ കുഞ്ഞുങ്ങൾ ഭക്ഷണം കഴിക്കാൻ മടി കാണിക്കുന്നു and that will lead to underweight. And these are some of the depression disorders which is seen in the children. And the mood disorders is common for people to feel happy and energized at all times and sad. ഇല്ലേ, സാധാരണ മനുഷ്യർ ചില സമയത്ത് വളരെ ഹാപ്പി ആയിരിക്കും, ചിലപ്പം situations in the which they face in their life, they may be sad for some time or they may be very less active for some time, and this may be due to some of the situations which they have to face in the life. And depression is a mood disorder. Depression is a mood disorder. A mood disorder involves a disturbance in a person's social or emotional state. A mood disorder will affect the person's emotional state or mood, and this mood disorder may be expressed in the form of extreme depression. അല്ലേ, മൂഡ് ഡിസോർഡർ എന്ന് പറയുമ്പോഴേക്കും ആരോടും മിണ്ടാതെ എപ്പോഴും ഇങ്ങനെ മൂടി അടച്ചിരിക്കുക. That may be depression or excessive elation or a combination of these. അല്ലെങ്കിൽ എക്സസ് ആയിട്ട് എന്തിലെങ്കിലുമൊക്കെ ഇൻവോൾവ് ചെയ്യുന്നത് എക്സ്ട്രീം കണ്ടീഷൻ, ഒന്നുകിൽ വളരെ മിണ്ടാതിരിക്കുന്നു അല്ലെങ്കിൽ എക്സ്ട്രീം എന്തെങ്കിലും കണ്ടീഷൻസിലോട്ട് പോകുന്നു, or a combination of these two. That is known as depression. Then the primary characteristic of a depressive disorder is that the individual will feel dysphoric or വിഷമം, എപ്പോഴും ഒരു സങ്കടമായിരിക്കും, ഒരു സന്തോഷമില്ല. that person will look. Depression will not have a smile on their face. They will be always sad. That is sadness. But we are very happy to look at some people's face. They will be very energetic. They will be always having a beautiful face, a smile on their face. It doesn't mean that they don't have problems. But the effective individual is the one who can overcome those problematic situations without affecting others. നമ്മളും happy ആയിട്ടിരിക്കുക, ചുറ്റുമുള്ളവരെയും happy ആയിട്ട് വെക്കുക. All individuals are having different problems. That is it's a part of life. The primary characteristic of depressive disorder is sadness or mood disorder, and this individual will be having depression feelings. And the major depressive disorders are, this is major depression or MD. The major depression is the one which is usually faced at adolescence, and most of the illness will begin after 12 years. 12 plus or puberty ഒക്കെ attain ചെയ്ത് adolescence-ലോട്ടൊക്കെ പോകുമ്പോഴായിരിക്കും most of the problems arises in people after adolescence, and the illness may be most common and some schizophrenia, bipolar disorder, panic disorder, social anxiety disorder, eating disorder, കഴിക്കുന്നതിനുള്ള disorder, proper ആയിട്ട് കഴിക്കത്തില്ല, proper ടൈമിന് കഴിക്കത്തില്ല, obsessive compulsive disorder, addictions. We will come to each of this one by one. Then the major depressive disorder involves acute time limited periods. The major depressive disorder or MD means it is time limited. അല്ലെങ്കിൽ ചില സമയത്ത് മാത്രം, ചില ആൾക്കാരിൽ പ്രത്യേകിച്ച് സമയമൊന്നും വേണ്ട, മഴക്കാലം വന്നു കഴിഞ്ഞാൽ ഭയങ്കര അങ്ങ് ഡിപ്രഷനാണ്. That is, it's something like seasonal. Major depressive disorder is something which is seasonal because it is limited to some time. ഒരു സമയം, കുറച്ച് സമയത്തേക്ക് മാത്രമേ കാണുകയുള്ളൂ. That is known as the MD or major depressive disorder, and it is time limited during which the intense symptoms of disorder are evident. ഇപ്പോൾ ഒരു മഴക്കാലം അല്ലെങ്കിൽ വേനൽക്കാലത്ത് ഭയങ്കര ഡിപ്രഷനാണ്, മിണ്ടത്തില്ല. Maybe due to some reason, the economic crisis, financial crisis, or maybe due to some personal matters. That is what is known as MD or major depressive disorder. The point which you have to remember is major depressive disorder is time bound, or it is time limited, or it is seasonal. അതൊക്കെ നമുക്ക് പറയാം. time limited. ഒരു പ്രത്യേക സമയത്ത് 7 ദിവസം, 6 മാസം, 1 മാസം, അല്ലേ? ടൈം ലിമിറ്റ് ഉണ്ട്. Then next is dysrhythmic disorder. Dysrhythmic disorder, it is very it's more chronic. Major depressive disorder, it's not too that problematic. The dysrhythmic disorder is more chronic, that is but less severe depression, and this lasts for at least 2 years in adult. 1 വർഷത്തോളം അല്ലെങ്കിൽ 2 വർഷത്തോളം 3 വർഷത്തോളം കുറേ നാളത്തേക്ക് അതിങ്ങനെ കണ്ടിന്യൂ ചെയ്യുകയാണ് എങ്കിൽ that is known as dysrhythmic disorder. So that is a difference between major depressive disorder and dysrhythmic disorder. In major depressive disorder, first we'll come into the details. The emotions of the major depressive disorder involve sadness, അല്ലെങ്കിൽ dysphoria. Dysphoria means വിഷമം, ദുഃഖം, sadness, heaviness, mood swings. We'll be having some mood swings and anxiety, or then ordinary activities will not be done in a proper manner. We'll be always sad. That is known as major depression. And the major depression symptoms usually in case of teens may be using recreational drugs or alcohol, and those who are having this depression, not always. Depression ulla ellavarum drugs or alcohol use cheyyunnilla. Some of the common symptoms among the teens who are using recreational drugs or alcohol, eating or sleeping too much, കൂടുതൽ കഴിക്കുകയോ അല്ലേ? Anything in excess is harmful. I have said in the previous class. അധികമായാൽ അമൃതം വിഷം എന്ന് പറയുന്ന പോലെ anything in excess is harmful to your body. If you eat more, it is dangerous. If you sleep more, it is dangerous. If you are not sleeping also, not good. So eating or sleeping too much will harm the individual. Then loss of interest. ഇല്ല, peer group. നമ്മുടെ ഏജിനോടുള്ള കുട്ടികളുടെ, ഇപ്പോൾ for example, you have in a class, if you're having 25 students, all this among this 25 students, if one student is not interested in taking part in the activities which is done in the class, or he is not involved in the activities, or if he keep himself away from the group, that will be a signals or signs or symptoms of this depression in teens. And a person with this depression will will be having sad emotions. They will be impaired at home, at workplace, at school and all. But some depressed people will show the opposite symptoms. ചില ആൾക്കാർ എന്താണ് eating disturbance, I said eating disturbance ആകാം, or maybe they will be having some sleeping disorder. Now, next is schizophrenia. Schizophrenia is a disorder with a range of symptoms involving disturbances in the content of thought. And schizophrenia, literally it means fragmented brain. Schizophrenia എന്ന് പറഞ്ഞാൽ it is simply the fragmented brain, and you can see here the the picture of a schizophrenic brain and a healthy brain, and it is the most complex chronic psychiatric disorder that affects a person's thoughts, feelings and behavior. അതൊരു heterogeneous syndrome ആണ്. Syndrome എന്ന് വെച്ചാൽ എന്താണ്? Group of disorders-നെയാണ് നമ്മൾ syndrome എന്ന് പറയുന്നത്. Syndrome means simply group of disorders. പല കാര്യങ്ങൾ group of group of disorders-നെയാണ് syndrome. For example, ഇപ്പൊ ഉറക്കക്കുറവ്, ഭക്ഷണം കഴിക്കാത്ത, weight loss, അങ്ങനെ കുറെ കാര്യങ്ങൾ ഒന്നിച്ച് വരുമ്പോഴാണ് അതിനെ syndrome എന്ന് വിളിക്കുന്നത്. Schizophrenia is very complex problem, and it is a syndrome which involves delusion, hallucination, impaired psychosocial functioning. Proper coordinated ആയിട്ട് those people will not be able to communicate with the other people in the community. Then this may be caused due to this schizophrenic condition is a disorder which was named as he named this disorder, a person, Emil Kraepelin, named this disorder as dementia, and it is supposed to be the degeneration of the brain, and it will lead to the disintegration of the whole personality of that individual. And the four fundamental features of schizophrenia are association. Schizophrenia, 4 fundamental features are association, then 2, affect, then ambivalence, then autism, these are the 4 fundamental features of schizophrenia. The Bleuer എന്ന് പറയുന്ന the physician identified this as 4 A's, that is association, that is thought disorder. He may not be able to associate between things. ഇപ്പോൾ പറയുന്നത് ഒന്നിനെ കുറിച്ചും പ്രവർത്തിക്കുന്ന വേറൊന്നുമായിരിക്കും. ഇപ്പോൾ കയ്യിലൊരു ആപ്പിൾ എടുത്ത് ഒരു ചെറിയ എക്സാമ്പിൾ പറഞ്ഞാൽ, ഇഫ് യു ലുക്ക് അറ്റ് ആപ്പിൾ, ദാറ്റ് പേഴ്സൺ വിൽ എന്താണ് ആപ്പിളിനെ കുറിച്ച് പറയുന്ന പോലെ നമുക്ക് തോന്നുമെങ്കിൽ he will be talking about mango. That is what in his actions and in his verbal communication, or his, that is a thought disorder. There will not be a connection in between what he does and what he says. That is known as association. Then affect. This disorder of experience and expression of emotion, and there is at this affection means at inappropriate situation some individual will be laughing. Maybe we, or for a simple example is, we think that during a funeral or something like that, there is no meaning for a person to burst in laugh and all. So at times these people who are these affected people may laugh at such inappropriate situations. That is, in sad situation these people may laugh. The ambivalence is the ability to make or follow through on decisions, and they will not be able to make any decisions, or they will not stick on to what was being said by them. That this, and autism is a tendency, syncretic style, that is odd or eccentric style of thought and behavior. ഒരു എന്താണ് പ്രോപ്പർ ആയിരിക്കില്ല, എക്സെൻട്രിക് ആയിട്ട്, ചിലപ്പോൾ ഹൈപ്പർ ആക്റ്റീവ് ആയിട്ട് പെരുമാറാം. There is will not be, we can't predict what they are going to do. അതാണ് schizophrenic പീപ്പിളിന്റെ എന്താണ് എഫക്ട് വരുമ്പോഴുള്ള character expressions. These are the 4 fundamental features. Association, they will not be able to associate between speech and act. Affect means there will not be able to experience the expression of emotion, or they will act inappropriately in inappropriate situations, such as in a sad situation they may laugh. Ambivalence is the ability to make or follow through, is the tendency to maintain idiosyncratic style. Then next is obsessive compulsive disorder. Obsessive compulsive disorder is, maybe some, at least one or a few of us who are here will be having some disorders like this. That maybe I'll come step by step. That is obsessive compulsive disorders, or it is a type of anxiety disorder. Obsessive compulsive disorder is a type of anxiety disorder, and usually the main thing associated with this is the behavior. I mean, you can, there's no proper medication or anything like that. There should be a change in the behavior. So behavioral therapy is mainly did for this. Now let's see what it is. So, obsessive compulsive disorder, it's an anxiety disorder, and it is characterized by a combination of 2 distinct abnormal behaviors. രണ്ട് abnormal behaviors combine ചെയ്യുന്നതിനാണ് obsessive compulsive disorders എന്ന് we say. One is obsession and another one is compulsion. So obsessive compulsive disorder is a combination of obsession and compulsion. Obsession is, let's see what obsession is. Obsession is a persistent and intrusive idea, thought. കൂടുതലും thoughts ആണ്, ചിന്തകൾ. Thoughts are dominating here. Impulse or image. That is what is known as obsession. So it is an unwanted, intrusive, persistent ideas, thoughts, impulses or image that cause marked distress. Actually thoughts are which is dominating in this obsessive compulsive disorder. This is obsession. It is a persistent, intrusive idea, and people with obsession will recognize the fact that these cognition arise within their own disturbed thought process. ഇല്ലേ? Obsessive compulsive disorder എന്ന് പറയുന്നത് അവരുടെ തന്നെ ചിന്തകളിൽ തന്നെത്താനെ ചിന്തിച്ച് എടുക്കുന്നതാണ്. That is known as obsession. And they desperately try to ignore or suppress these thoughts, and they will not be able to do things. And one small example is some people are over hygienic. A small example is, I will say, there's obsession. Obsession means there are some people who are always wearing ironed clothes. A small example, ironed clothes. A person's habit is of wearing ironed clothes. That is his obsession, and according to his thought, wearing ironed clothes is the best practice which a standard individual has to do. But when he see another person on his seat, maybe in a bus or car, if he is having a person with a crumpled shirt without ironing his shirt, if anybody is sitting along with him, he will be totally disturbed by looking at this shirt or anything like that. At the moment that the other person leave this place, this person will be normal. That is known as obsession. Obsession is simply thought. So you can either ignore, in such situation you can either ignore that person. It is a common thing which we can do. But those people who are having this obsession, this disorder, will look at that person, they will be totally distracted, and they will not be able to concentrate on their thoughts or like that, or they will leave the place. That is, the examples of this obsessive compulsive disorders are, this obsessions are, like I said, some people may be over hygienic. That is, germs, doubts. Some people have doubts like whether, or after leaving the house, they will always have a thought that the gas is on or the back door of the house is not locked every day, not one day. Or fear among other people, fear of other people. That is obsession. Then compulsions. Compulsions is the unwanted repetitive behavior. Compulsions are carried out in an effort to reduce the anxiety or distress. To reduce this anxiety, compulsions arises naturally. That is, I said, over hygienic person have always a fear of contamination. He'll be always washing his hands. A person who is over hygienic will be having a practice of washing his hands or sanitizing his hands. Simply while traveling in a common trains, tram or anything, what these people do is they will be always, after touching the window, they will be sanitizing their hand. I'm not talking about the situation now. In an ordinary situation, after touching the window, after sitting anywhere, before sitting there, they will wipe the whole place, and they will not allow their dupatta or anything to fall on the nearby place or anything like that. They will be taking extreme care, and that's compulsions are carried out in an effort to reduce the stress. They will be always sanitizing the place where they are sitting. So this combination of obsession and compulsion result in a condition called this obsessive compulsive disorder or OCD. Obsessive compulsive disorder. ഞാൻ പറഞ്ഞു ഒബ്സഷനും കമ്പൽഷനും കൂടെ ചേർന്ന് വരുമ്പോഴാണ് obsessive compulsive disorder ഉണ്ടാകുന്നത്. And obsessions will lead to anxiety, and as a result of anxiety they will be compelled to do certain thing and they will be relieved. For example, obsession, a feel of unhygienic എന്നൊരു obsession വരികയാണ്. Unhygienic. That may lead to the anxiety of germs. And compulsion, usage of this sanitizer. The usage of the sanitizer, and will be happy or will be relieved after the use of these things. This is OCD cycle or obsessive. You can write this down. This is OCD cycle and or disorder, and the symptom of OCD are time consuming. It is irrational, it is distracting that individual, and the individual only should think whether he should come out of this disorder or not. I said always a treatment for this is simply behavioral therapy. The individual should think. And here this is what is OCD cycle or compulsion disorder. Behavioral therapy is the only solution for this behavioral therapy. That person should think by himself. That is behavioral therapy. Behavioral therapy is the only solution for this. Behavioral therapy. That person should come out of this disorder by himself by taking some time. Then next is substance abuse disorders. Substance abuse disorders. What is addiction or what is substance abuse? Substance abuse disorder is, you can see here, and this what എന്താണ് addiction? If any substance, a chemical which alters a person's mood or behavior, that is what is that any substance which is a chemical that alters a person's mood or behavior when it is smoked, injected, drunk, inhaled or swallowed in pill form. സബ്സ്റ്റൻസ് അബ്യൂസ് എന്ന് വെച്ചാൽ എന്തെങ്കിലും ഒരു കെമിക്കൽ സബ്സ്റ്റൻസ് ഒരു വ്യക്തിയുടെ മൂഡിനെയോ സ്വഭാവത്തിനെയോ മാറ്റുന്നു. ഇനി ആ കെമിക്കൽ സബ്സ്റ്റൻസ് എങ്ങനെയൊക്കെ ഉപയോഗിക്കാം? ഒന്നുകിൽ പുകയായിട്ട് ഉപയോഗിക്കാം, അല്ലെങ്കിൽ ഇൻജെക്ട് ചെയ്യാം സെറിഞ്ച് വെച്ച്, അല്ലെങ്കിൽ കുടിക്കാം, or it can be inhaled, സ്മോക്ക് ആയിട്ട്, ഇല്ല നമ്മൾ ഹുക്ക എന്നൊക്കെ പറയുന്ന പോലെ it can be inhaled, or it can be swallowed, chew ചെയ്യാം, or it can be chew ചെയ്തതിനു ശേഷം it can be consumed. Swallow ചെയ്യാൻ means വിഴുങ്ങുക in the pill form. ഇതിനെയാണ് substance abuse എന്ന് പറയുന്നത്. That is what is substance abuse. Then people who abuse the substances find that their lives are affected in many ways. People who are using these things are affected in many ways, and the main feature of this abuse is the main feature of this usage of these chemicals are if the individual continues to use these substances. If a person continues to use these substances, it is clear that such behavior will have significant risk or creates problems in living. And the commonly used drugs are, or this commonly used substances are, drugs എന്ന് പറയുന്നില്ല, substance abuses are, will cause psychoactive substance use. Maybe it can be alcohol, or it can be psychoactive drugs, or any other chemicals or volatile solvents. That is what is volatile means inhale ചെയ്യുന്നത്, അല്ലേ? That is known as volatile solvents, മണക്കുന്നത്. അതിനെയാണ് substance abuse. And there are, there are small disorders like there are some people who like to smell the petrol or like to smell the kerosene, like not like just smelling and leaving it, continuously smelling it. That is known as volatile substances. Then this substance abuses That is, the substance abuse, people who abuse substances find that their lives are affected in many ways, and they will be having some increased risk towards the usage of chemicals such as alcohol, cocaine, amphetamines, LSD or lysergic acid diethylamide, PCP, or drugs like benzodiazepines and painkillers, morphine, etc. And the symptoms of this alcohol dependence include compulsive use or physically, like they will be hyperactive or less active. Under extreme conditions, either they will be hyperactive or they will be less active. And the addict cannot function without the usage of the substance. Or substance, if you get addicted, that person cannot work properly without that substance. ഒരു സാധനത്തിന് നമ്മൾ അഡിക്റ്റഡ് ആകുക അല്ലെങ്കിൽ അടിമപ്പെടുകയാണ് എങ്കിൽ അതില്ലാതെ ഒരു നോർമൽ ആക്ടിവിറ്റി ഡെയിലി ഇൻവോൾവ് ചെയ്യുന്ന ആക്ടിവിറ്റീസ് ഒന്നും ദാറ്റ് പേഴ്സൺ വിൽ നോട്ട് ബി ഏബിൾ ടു ഡു. ആ സബ്സ്റ്റൻസ് ഉണ്ടായിരിക്കണം. ഇപ്പൊ സിംപ്ലി കൊക്കെയിൻ അല്ലെങ്കിൽ കനാബിസ് ആണെങ്കിൽ കനാബിസ് അഡിക്റ്റഡ് ആയി കഴിഞ്ഞാൽ കനാബിസ് ഉണ്ടെങ്കിലേ ഡെയിലി ആക്ടിവിറ്റീസ് ഒരു ദിവസം ചെയ്യുന്ന കാര്യങ്ങളൊക്കെ ചെയ്യാനായിട്ട് പറ്റുകയുള്ളൂ. That is what is the problem of this addiction. And this long-term alcohol use and addiction will lead to temporarily lead to the functional imbalance in their life, and it will include malnutrition, and the physiological effects of the body will be affected if that person is subjected to long-term usage of this drugs, and these include liver cirrhosis, malnutrition, there will be brain damage, and this excess use or abuse of this chemicals will lead to malfunctioning of heart, etc. These are the negative effects of this substance abuses. Substance എന്ന് പറയുമ്പോൾ അതിനകത്ത് ഡ്രഗ്സ് വരാം, ആൽക്കഹോൾ വരാം, എന്ത് വേണമെങ്കിലും ഇൻഹേൽ ചെയ്യുന്ന എന്തെങ്കിലും ആകാം, കോഫി ആകാം, എന്തിനെങ്കിലും എക്സസ് ആയി കഴിഞ്ഞാൽ ഇപ്പൊ ചില ആൾക്കാർക്ക് ഒരു സിമ്പിൾ എക്സാമ്പിൾ ഇഫ് ഐ സേ there are people who cannot do morning they will have a tea. Without that tea they will not be able to do the work at home. ആ ചായ കുടിച്ചില്ല എങ്കിൽ ആ തലവേദന വരും, ഫുൾ ഡേ തലവേദന ആയിരിക്കും. ദാറ്റ് മീൻസ് ദാറ്റ് പേഴ്സൺ ഇസ് അഡിക്റ്റഡ് ടു ദാറ്റ് ടീ ഓർ കോഫി. അഡിക്ഷൻ എന്ന് പറയുമ്പോൾ ആൽക്കഹോൾ എന്നുള്ളതല്ല, എനി സബ്സ്റ്റൻസ് അല്ലെങ്കിൽ സബ്സ്റ്റൻസ് അബ്യൂസ് എന്ന് പറയാൻ ആ ചായ കുടിച്ചില്ലെങ്കിൽ തലവേദന വന്നിട്ടൊന്നും ചെയ്യാൻ പറ്റില്ല എന്ന് പലരും പറയുന്നത് കേട്ടിട്ടുണ്ട്. ദാറ്റ് മീൻസ് അവര് അതിന് അഡിക്റ്റഡ് ആണ്. Then the causes and risk of this substance abuse is it will lead to mental illness. Excessive use ആയി കഴിഞ്ഞാൽ that person will be having a stressful situation, and that person will be, if it is untreated, he will become mentally ill. Then the family will be affected. There will be having some peer pressure will be there, poor self-esteem, സ്വന്തമായിട്ടുള്ള ഒരു അഭിമാനം നഷ്ടപ്പെടും, poor self-esteem, depression will be there, and even he will not be interested, he or she will not be interested in any of the activities which is done by the peer group. And family, there are some, to some extent the genes also have a role in addiction. Now treatment of this is include the total abstinence. The first of all, the treatment is abstinence. Abstinence means ഉപയോഗിക്കാതെ ഇരിക്കുക. Abstinence means abstinence. Abstinence means full stop to that substance. അതിനാണ് abstinence എന്ന് പറയുന്നത്. Supportive individual, then next is counseling. Counseling വഴി weight dose കുറയ്ക്കുക, then he will be എന്താണ് stop, that is abstinence എന്ന് വെച്ചാൽ stop ചെയ്യുക, stoppage of the substance, alcohol or whatever it is, counseling, then medical treatments, that like you can have another substitute for alcohol. Alcohol കുടിക്കാൻ തോന്നുമ്പോഴേക്കും അല്ലെങ്കിൽ ആ ഡ്രഗ് കഴിക്കാൻ തോന്നുമ്പോഴേക്കും ആ സമയം ഒരു ഓറഞ്ച് കഴിക്കാം, ഒരു ആപ്പിൾ കഴിക്കാം, അങ്ങനെ യു ക്യാൻ സ്ലോലി എന്താണ് കം ഔട്ട് by yourself. As I said in the case before, that person itself should take a step to keep away from these things. So that is that you should find some appropriate substitutes for these substance. That is what is known as substance abuse and disorders. Hope I'll stop today's class with this and continue domestic violence. Only one more class will be enough for completing your portion, and I'll let you know the time of the class. And with this, I'm stopping today's class, and I'm sorry for the inconvenience that was caused in between due to this internet connectivity problems. And thank you for your listening.